Did you know health insurance is less than 100 years old? I want to give you a quick history lesson because it's important and help you understand what we're going through today. Now, back in 1929, the Great Depression, there was a lot of fear. People were losing jobs. People were going bankrupt. There was a lot of things going on. And there was a guy in Dallas, Texas, who was running a hospital at Baylor University. And he realized we need to make sure that there's healthcare for people if they need it, right? And so what he did is he developed what was called a hospital plan for teachers, where they could pay $6 a year, 50 cents a month, right, to have up to 21 days in the hospital if they needed. Now, this was the first rendition or creation of health insurance that we know today, but it has definitely dramatically changed over time and become a big, massive $5 trillion industry. Now, what happened? How did it become such an important part of our job compensation? Well, the biggest thing was in World War II. When we entered World War II, there was a real struggle for talent, and companies were competing and raising wages to try and pull in talent because there was a low supply. Everyone was overseas fighting. And the government stepped in and locked wages and said, hey, there's a Stabilization Act of 1942 that said wages they're capped. So employers, they got creative, right? That's capital markets. And they said, what if we offer health insurance and pay for these hospital plans for our employees? And that's where it really took off. And the government said, yes, that's a great idea. You can do that. We're only focused on the cash. That's the wage lock. Other benefits like employee benefits we know today are not a part of that. They also went the next step and said, hey, we're also not going to tax you on that. We're not going to tax the company or the employee. So that was a huge accelerator and led us through a few different changes in regulation over the years. So obviously, the most recent Affordable Care Act. But what has happened is there's been a consolidation of power of where healthcare, how healthcare is priced and who is benefiting from those prices.